Microphone, Daisy, microphone. Você leva, você também vindo? Oi, Daisy.
Oi.
Daisy, não estou ouvindo. Microphone, Daisy. Oxe. Meu Deus, tem só... Deixa eu esperar um pouco para ele voltar, tá bom?
Tá bom. Acho que ela desistiu.
Eu sei, não, outra pessoa não vai entrar. Então, ninguém vai entrar, porque até só Daisy está confirmado. Então, o que vai acontecer, Lucilea? A gente vai passar essa aula para outro dia, tá bom?
Combinadíssimo. Sem problemas.
Tá bom? Muito obrigado. Tenha um bom fim de semana até segunda, tá?
Você também. Até segunda. Tchau, tchau.
Tchau, tchau. Okay, guys, so good evening. We didn't have a quorum, so I'm going to be doing this class recorded. So we're going to be looking at the NCLEX exam, and our focus today is priority ABC, Maslow, and safety. All right. Now, let me ask you a question, and you can put your answers on the platform questionnaire. Okay. If two patients need help, how do you decide who to see first? And the second question is, what is more urgent, pain or breathing difficulty, and why? Our third question is, what does priority mean in nursing? All right. So I would like for you to put your answers in the platform chat. All right. All right. So in NCLEX, priority means choosing who or what comes first. Cert. The NCLEX test focuses on decision making, patient safety, clinical urgency. All right. And the key question is always in the exam, who is at greater risk right now? All right. So there you always choose the priority. Okay. Now, Let's look at our ABC framework. I'm going to share my screen. Now, in the ABC framework, the most important priority tool, ABC, all right? And you know, in nursing, ABC is an acronym we use, all right? So it's airway. A stands for airway. Is the airway open and clear? B, breathing. Is the patient breathing? C, circulation. Is blood flowing properly? All right, so that's the ABC framework. The rule is airway, breathing, circulation. For example, patient not breathing equals immediate priority, or priority is to get that patient up and breathing. Okay, so that's what priority means in the ABC framework. In the Maslow's hierarchy, Maslow helps organize patients' needs. One, in physiological, where it's oxygen, food, water. Two, safety. Three, love and belonging. Four, esteem. And five, self-actualization. NCLEX focuses always prioritize physiological needs first. All right. So it's oxygen, food, water. Okay. That's the focus on the NCLEX priority. Always prioritize physiological needs first. Example, oxygen problem leads to anxiety. Okay, great. Any questions? Now, there are a number of safety principles that, you know, is always a priority. Ask yourself, is the patient at risk or in harm's way? Can something become life-threatening at the time? And never, ever ignore serious symptoms or delay urgent care. If an option prevents harm, strong candidate. All right. So in your answers, if an option prevents harm, that's most likely, or is one of the, you know, stronger answers. That's what strong candidate means. Okay, great. Combining frameworks, you must use all together: ABC, Maslow, and safety. Example, patient A, anxiety. Patient B, low oxygen saturation. ABC plus Maslow equal oxygen priority, and safety risk is death. All right. So basically, the correct answer would be B, right? The correct answer would be B. Okay. Any questions? Great. Priority in action. Give me your answers. Right? Which patient should the nurse see first? Patient A with mild fever. Patient B with chest pain. Patient C asking for food. Patient D waiting for discharge. Now think. Chest pain equal possible heart problem. Circulation issue equals high priority. So naturally, your answer should be B. All right. Once there's chest pain, it suggests there's heart problem. Usually suggest. Okay. Great. Now, in our key vocabulary slot, we're looking at, I'm going to say them in English and in Portuguese. Priority, prioridade. Airway, via aérea, ar aérea. Breathing, respiração. Circulation, circulação. Physiological, fisiológico. Safety, segurança. Risk, risco, risco. Now to our reading section. Lucas is studying for the NCLEX and learns that not all patient problems have the same priority. All right. And as nurses, we know that when we do triaging, sorry about that, guys, my microphone just went out. As nurses, we know that when we do triaging, we prioritize on color, right? We tend to, put the patient in color. I don't know in Brazil if they do, but not all patient problems have the same priority. All right. At first, what Lucas does is he focuses on symptoms like pain and discomfort. However, he later understands that the NCLEX prioritizes life-threatening conditions. Right now, when he reads a question, he immediately checks for ABC, airway, breathing, and circulation problems. If none are present, he considers physiological needs and patient safety. This structured thinking helps him to choose the correct answers even more consistently. All right. So in when you're doing your exam, this is the strategy you should use. All right. Always check for ABC. Is the airway open? Is the patient breathing? Is blood circulating? If none of those are at risk, then we go for physiological needs and patient safety. All right. So the questions, the answers should give you the clues. All right. Well, at first, Lucas basically focused on symptoms, right? Like pain and discomfort, right? So he'd focus on pain and symptoms at first, but the NCLEX prioritizes patient safety at all times. All right. And in helping him to improve, right, he later understands that the NCLEX prioritizes life-threatening conditions at all times. All right. So that's where he improved. Okay. Great. Now, our grammar focus are on superlatives for priority. Superlatives for priority. All right. Important is self-explanatory. However, when we put a superlative before important, like most, it means it's urgent. All right. It's more urgent than normal. All right. And then the next one is urgent. Most urgent. The most urgent patients get cares first. All right. And the highest priority as a nurse is patient safety. All right. For example, airway is the most important priority. Bleeding is the most urgent condition. Oxygenation is the highest priority. All right. So when you will use superlatives, we basically um, up the scale, right? It gives it more urgency. All right. So the superlatives makes it more urgent. Most is more urgent. And the opposite of that is basically less. All right. Um, the opposite of most is less. Less. The opposite of highest, low priority or lowest priority. All right. So just that's just an example. All right. Great. Now, controlled practice. Complete the questions. So, number one, airway is the most important priority. Shock is the most urgent condition. Number three, bleeding is, I'm breathing, I'm sorry, breathing is the highest priority. All right. And a fair practice, answer in English. What is the first thing a nurse should assess? Airway, breathing, circulation, right? Why is oxygenation a priority? You can put your answers when you access this class. You have a chance to write your answers. Okay. All right. Any questions so far? Put them in the chat. Great. Now, our role play this evening is basically your homework. All right. You are deciding which patient to see first, where student A, student B, you explain your reasoning. All right. And you're basically going to be using this patient is priority because the biggest risk is on according to ABC, right? So these are the what you're going to be using to answer, all right, or to create. Just create a mini role play or a mini dialogue to answer these to and use these in your answer. All right. So the scenario is a student, student A, I'm sorry, you are deciding which patient to see first. Student B, you explain your reasoning for choosing the patient you decide to see. All right. All right, guys. This was a very short lesson, giving you some tips on the NCLEX exam. I want to thank you so much for sticking with me. Have yourselves a wonderful day, and I'll see you in the next class. Bye-bye.